Say goodbye to confusion. I'll simplify Medicare Part B excess so even beginners can understand it. Alright, let's dive into the world of Medicare Part B excess and understand how it can impact your healthcare costs. Do you know what Medicare Part B excess is, and how it can impact your healthcare costs? Medicare Part B excess is a crucial aspect of Medicare that every beneficiary should grasp. It plays a significant role in determining your out-of-pocket expenses for healthcare services. Many individuals find themselves puzzled when trying to unravel the complexities of Medicare Part B excess. The terminology and calculations can be overwhelming, leading to confusion and uncertainty among beneficiaries. So, let's break it down for you. Medicare Part B excess charges occur when a Medicare provider bills an amount higher than the Medicare-approved amount. Providers can charge these extra charges if they accept Medicare but not Medicare assignment. The excess charges can be up to 15% higher than the approved amount. Excess charges can add up quickly, especially for frequent visits, outpatient surgery, or specialized care. It's important to know if your healthcare provider accepts Medicare assignment to avoid these costs. Certain states have passed laws that make it illegal for healthcare professionals to charge Medicare Part B excess charges. These states are Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, Vermont. How to avoid Medicare Part B excess charges. Don't assume that a doctor, supplier, or provider accepts Medicare. Instead, always ask whether they accept assignment before you book an appointment or service. It's a good idea to double-check that they accept Medicare and ask how much the service will cost, even with doctors you have seen before. Does Medigap cover Medicare Part B excess charges? Medigap is supplemental insurance that you might be interested in buying if you have original Medicare. Medigap policies help pay for the gaps left in original Medicare. These costs include deductibles, co-payments, and co-insurance. The two Medigap plans that cover Part B excess charges are Medigap Plan G and Plan F. In summary, understanding Medicare Part B excess is vital for managing your healthcare expenses. By being informed about how it works and its implications, you can make informed decisions about your healthcare needs. So, remember to stay informed and proactive about your Medicare coverage to avoid any surprises down the road. And that's a wrap. If you found this information helpful, consider exploring more videos on Medicare coverage to enhance your knowledge further. Feel free to share your experiences or questions about Medicare Part B excess in the comments section below. Thanks for watching, and until next time.